So just a few clips from the Intuitive Surgical website, just showing some of the attributes of the robot. First here, just showing how easy it is to suture, and an example of how the movement of your wrists moves the actual two robot instruments. And there are three components to the robot. There's the actual surgeon console that the surgeon sits at, and he looks down a 3D viewfinder, and then he has these two joystick type arrangements. There's then the actual robot cart, where you see here the person is removing an instrument from. There's a picture a bit later on showing that in a bit more detail. And these are the two kind of surgical controls that the surgeon has, one for the right hand, one for the left hand. And you can see there's like a pincer grip needed. And moving your fingers back and forward opens and closes the instrument. And you see here there's an example of where the surgeon looks down. This is the 3D HD viewfinder. So this is, you see the surgeon looking down this this viewfinder, and an example here is of a dual console, two consoles. It's what we have at the Royal Hampshire Hospital. It's very, very good for teaching and for training. It's akin really to learning to drive a car. There's master controls, and you can teach somebody to learn how to operate using the robots. It's a fantastic way to learn minimally invasive surgery. And here is the robot cart that I was talking about. You see there are four arms. There is one for the camera in the middle, and then there are three operating arms. On the right hand side, that instrument is controlled by your right hand, and here on the left there are two arms. One's controlled by your left hand, and you can switch from one instrument to the other. So removal of the prostate for prostate cancer was the index operation for the robot back in 2000, and you see here a comparison of the incisions between the robotic prostatectomy and the traditional open prostatectomy. The actual incision for an open prostatectomy does add some morbidity, and you are kind of in hospital usually for 2 or 3 days longer. It does take you a number of weeks to recover and get back to daily activities. There's a schematic here showing the relationship of the prostate gland that is there to the bladder above it and to the nerve bundles that run kind of next to the prostate. The actual operation of radical prostatectomy is to remove the whole prostate en bloc along with the seminal vesicles, which then leaves a hole in the bladder, termed the bladder neck, and then it also leaves an open-ended pipe called the urethra. And once the prostate is removed, then the urethra and the bladder are reattached in what is called the anastomosis, and that is done using suturing. And as you've seen previously, the robot allows very, very precise suturing, leading to a watertight anastomosis, which decreases any potential complications of wound healing. This is an amazing example of the dexterity of the robot. What they've done here is that they fixed a grape. This is a life-size grape, and these are some of the robot instruments. What the operator is going to demonstrate here is actual skinning of a grape using the robot. As you'll see, it's quite impressive. One of the main features of the robot is that it actually can remove any human tremor. So in open surgery, any kind of human movement or human tremor is obviously can sometimes be a bit of a hindrance, but the robot is able to remove that tremor. So operating is very, very precise and delicate. The instruments are wristed, so there's kind of 360 degrees of rotation of movement, which makes it much easier to manipulate the instruments or any needles, and it makes for much more precise surgery. The second main operation in urology for the robot is the partial removal of a kidney for a kidney tumour, and this is termed a partial nephrectomy. And there's an animation here showing what's involved in a robotic partial nephrectomy. I mean, this can be done open, but it necessitates a very painful, morbid loin incision with the potential to break a rib, and that is a very painful incision that takes a number of months to recover from. Keyhole surgery or laparoscopy can also be used to do this operation, and though it reduces the morbidity of the large wound, actually, as you can see here, where you have clamps applied to the main vessels to the kidney, you only have kind of 20 minutes to remove the kidney and sew things back together again. Laparoscopically, this is very, very stressful and very, very difficult because of the complexity of suturing laparoscopically, but as you can see here, with the robots, suturing is much quicker and it leads to a much better operation.